Welcome to my educative channel. Today I'm going to talk about the difference between my personal technique and this technique. I'm talking about conventional blepharoplasty versus my personal. This is the conventional blepharoplasty that was developed in the 19th centuries. This is the incision, the lower eyelid that is extended beyond the canthal sternus, and this is the way that the auricularis muscle is cutting in order to look for the lower eyelid fat pads. And this is the way that is cutting, and more resection is done in the outer part of the lower eyelid. And here we can see the features. Nothing has changed. Most of the plastic surgeons around the world are performing the same technique. You can see Mayo Clinic today advertise the same technique. This is the same incision that cut the skin to look for the lower eyelid fat pads. Here is this picture is taken from internet. We can see the resection of the skin here. Most of the skin is resected in this area, and here we can see the skin cut with the scalpel and the lower eyelid skin removal. And this is the damage that is produced to auricularis oculis muscle in order to look for the lower eyelid skin, lower eyelid fat pads. And more skin is removed from the outer edge of the lower eyelid, just you see here. And here we can see this technique produces negative vectors that pull the lower eyelid down. Here we can see how the skin resection produces a negative vector that pull the tarsus down. And this is the result of this kind of technique. More or less, many patients suffer of this anocclusion of the eyelids. And this is the result for the resection of the skin and the damage of the muscle aponeurotic structures of the lower eyelid. And this is my father, 1940 years old. He never received any eyelid surgery, but this is the natural process of aging. The lack of strength of the auriculary muscles and the toxins of all the structure produce this kind of tropium. As you can see, if in a young patient we damage the auricularis muscle, when the time passes, can have a big problem. With this technique, like I said before, the only way to remove the lower fat pads, are making in a hole in the muscles, and this muscle is that produce a contraction to close the eyes. And this is the result of many patients that come to my clinic in order to improve this kind of results. And here you can see how another patient, a long scar and sclera show. Another cases. My proposal is a small conjunctival incision through which I can remove the lower eyelid fat pads, like we can see here. And this is the result with this technique. No skin damage, no muscle damage, no skin resection, and all these are the lower eyelid fat pad that I remove through a conjunctival incision. and here is the rejuvenation with carbon dioxide laser. The difference between one technique and another is that the conjunctival incision do not damage any structures and do not require stitches. Just a small incision here in the conjunctival. These do not produce muscles damage, no damage. Then it is impossible to think that by removing a thin strip of skin from the lower eyelid, we can rejuvenate the rest of the skin of the eyelid and also the periorbital area. My idea is, instead of removing the skin of the lower eyelid, my proposal is rejuvenate all the skin of the eyelid and also the periorbital area, as you can see here. I began to develop my technique in 1994. I received all honors for my contribution to the science, and nowadays doctors from all around the world come to my clinic in order to understand this technique. The future near, all around the world, this new technique will be performed. It is a fact. It is a fact. No skin resection, no muscle damage, no stitches. The idea is this: to nourish the skin. Periorbital rejuvenation using carbon dioxide laser generate skin contraction, stimulate and produce new collagen, and generate a general rejuvenation effect. My concept is rejuvenate and tightening the skin instead of cutting and damage the skin. This is a fact. I can do it. It's long-lasting results, no complication, maybe a little of redness, or sometimes the patient can have a little hyperpigmentation that lasts 1 month, 2 months. Nobody is going to have with a hyperpigmentation. Just only the side effects with this technique are prolonged erythema, can be 1, 2, 3 months, and depend on the energy of the light that is needed to use in order to contract the skin. If a young patient comes to my office, the recuperation is in 10 days because low energy is needed. But if I need to treat a patient with a lot of wrinkle, a lot of flacidity, the patient decide if she or he want to get unbelievable result just in one session, and the recuperation period will be a little longer. But if they have works, social activity, I can perform a lower energy laser, and some months after I can perform another laser. This is a patient coming from outside. This is in the operating room. This procedure lasts 20-30 minutes under local anesthesia. Three hours. Yes, 3 hours. No cutting, no stitches. This is a low energy laser. Low energy. This is the patient 3 hours after the procedure. And this is a patient 7 days after the procedure that It's going to take 7 days after the procedure airplane to Spain, and this is the video of the patient 7 days. You can see no scar here, no scar, a little redness, a little edema. You can see sclera show the lot of vascular reaction in the eye, ptosis, a lot of wrinkles, and this is after my procedure. My idea is a periorbital rejuvenation. This is my curriculum. I'm professor of medicine, I am chief plastic director. Just you can see a little redness that in this kind of patient, the redness must be last nearly 3 months because it's a high energy of laser. But the patient before, the redness is nothing. This patient from Spain, the redness is nothing, maybe nothing. In consequence of the previous surgery with the skin resection, and you can see here, and also they left a lot of wrinkles, and this is after laser treatment. It is impossible to think that if I want to improve the upper or lower eyelid, I also want to improve the periorbital area because we have wrinkles everywhere, and this is another patient. You can see the contraction of the skin, the improvement. When you are going to see a lot of pictures, you are going to see a vertical oval and horizontal oval. This vertical oval means elderness. You can see this line through the pupil, and is in the upper thirds of the oval, and this is in the middle. This means elderness, tiredness, sadness, and this is beautiful. The ability of the laser to contract, no scars, no wrinkles. Another patient that was operated with a conventional blepharoplasty, and this is after my procedure. You can see the ovals. Another patient. Eyebrow reposition, periorbital skin rejuvenation, and malar voluminization. This is very important, the malar voluminization when I treat lower eyelid blepharoplasty. Generally, it's necessary to give volume to the malar area because as the age passes, we lose volume in the malar area. And here you can see this, and just this red lines mean from here to here I never remove skin, and I do not leave scars. No lower eyelid deformation, no sclera show. The lower eyelid protect the eyes. My technique, blepharoplasty, and also volume of the malar area. and you can see this distance is because there are no volume of the malar area. What I'm trying to say is there is an intimate relationship between the upper eyelid and the eyebrow, and there is an intimate relationship between the lower eyelid and the malar area. Generally, when I treat the upper eyelid, I produce a reposition of the eyebrow. Generally, when I treat the lower eyelid, I give, if the patient needs, volume to the malar area. And both, always I treat the periorbital wrinkles. Okay. Lack of volume. Personal technique. Young patients. It's very important for this young patient do not have a scar or do not have a deformation of the lower eyelid. And with my technique, all this is possible.